we are speaking to?
So, as you said, my name is Elizabeth Quinn,
Mm-hmm.
and I'm from the UK. The
UK.
UK,
Okay.
yeah. And I live just north of the city of Portsmouth, which is on the south coast of England, in quite a rural area. I'm part of the Anglican Diocese of Portsmouth, and I'm a lay minister, which is like a catechist in Ghana, and I'm training to be a priest at the moment. And
Hmm.
about 18 months ago, part of my training, I came to Ghana for it and was in Wyoso Diocese in the town of Awaso with the people there.
Hmm. Okay. Like with
We also
the
have.
Ghanaian names, I'm struggling to identify what exactly she says. Is it Tanoso? You say in Ghana you were Tanoso where you were worshiping in Ghana?
I was in the town of Awaso in northwestern region
Hmm.
and at St. Matthew's Anglican Church.
Okay, St. Matthew's Anglican Church. At least I've gotten that one. But for the town or the community there, we'll let that one skip. Me and Mantifi. So, well, tell us the situation of COVID-19 in UK. You said you're in Portsmouth, to be precise. So, in UK and in Portsmouth, what is the situation of COVID-19 there?
Well, it's been quite sort of varied over the last year, and it's had some increases and then decreases as we've had various lockdowns, and we're on at least our third lockdown now, which means that we have to be at home as much as possible. We're only allowed to go out if we've really got to go out, like for work, but most people have to work at home from their computers instead of going into the office or wherever. And they but because of the lockdown and we're getting some vaccinations now, the levels of the virus have started dropping again, but it got very, very serious in January, and the death rates were rising and so on. But it's things are beginning to improve again, but we're still in lockdown for quite some time yet.
Okay, so how long has it actually been that you've been on lockdown?
Well, we had limited access before in November, December, and then on the day after Christmas, we were really into lockdown then, and it's been very limited being able to go out and about since then.
Okay, so since December, the day after Christmas, so that will be 26. So from the day after December, you've been on lockdown. Wow. So have you had a personal experience with this virus we are talking about, the COVID-19 virus? Have you had a personal experience?
Well, personally, I've been very fortunate that I haven't had the virus,
Mm.
but I family members have had it,
Mm.
and friends, and my mother-in-law, for instance, who was in a nursing home, and the rates of the virus were very high for the elderly because she was very elderly. And she got it and was very ill, but actually she did survive and she got through it, which we couldn't believe. So that was a wonderful thing. But some of my friends, elderly friends, have unfortunately they've died. And what was very sad about that was at the moment it's very difficult visiting elderly loved ones in the care homes, and so they might not have seen their families actually in person for a long time,
Mm.
and then they get very ill. So it's a very difficult situation, very sad for them and their families.
Well, graciously, you haven't had a personal experience, but you have indicated that you've had close family relations having the virus and all that. But tell us, how was it with a close family member contracting the virus, and the signs and the symptoms, what you have to go through as a family member, and what that particular infected person also had to go through, and what it took for the person to be free at the end. Tell us something about that one.
Well, I think it can be at all different levels because some family members just feel a little bit off color, a little bit ill, but
Mm-hmm.
nothing much. And for others, obviously, they have to go to hospital and be in intensive care and for quite some time. For my particular family member that I'm talking about now, my mother-in-law, she fortunately didn't have to go into hospital, but she, felt very ill and had a bad cough and, just was very poorly in bed. But eventually it started easing, and the symptoms eventually went away. But it took some time, and we at home, all her children around the country, were all very worried because we couldn't go and see her, thinking that maybe she probably wouldn't make it. But thank God that she did at that time.
Hmm.
Yeah.
Well, for the universal protocols for COVID-19, universal safety protocols, the wearing of face masks, the frequent washing of hands, the usage or application of hand sanitizers and all that. In Ghana here, and luckily you've been here before, so you might know what I'm talking about. We haven't had it easy. Sometimes it have to take the police and some personnel from the security agencies to enforce adherence to these particular protocols, the wearing of face masks and all that. In the UK, as you say you are, how has the response been from the public towards the protocols as has been laid down by the health authorities in the UK?
I would say that it's been a very positive response for most people. There are some people who don't want to have to comply with rules, but the majority of people really look out for the welfare of the whole country, and so they're willing to have to put up with masks and sanitizer and keeping their distance. And I think actually as the time over the last year, people have just got used to it and accepted it. So there's a very good majority response to caring for themselves and each other.
Yeah. All right then. Let's talk economy now. We can begin to talk about the impact of COVID-19 on the economy of the world at large. In Ghana here, we've had the government supporting some businesses with some amounts, and also as a means of sustaining some businesses and not allowing them to fold up or collapse. Some stimulus packages has been given out and all that. In the UK, has something like this been going on from the government, assisting or helping companies and businesses to help them stay afloat?
Yeah, very much so. I mean, quite early on in the pandemic, the government put in place for businesses like hospitality businesses, hotels and restaurants and pubs and so on, and where people couldn't work because they had those facilities were closed because of the virus. And obviously there wasn't any income for the businesses. So the government introduced a furlough system where they paid 80% of the wages for those who weren't allowed to go into work because the businesses were shut. So that's been a massive support in maintaining the businesses in the long term. And I think for small businesses that are really affected, there are grants, a lot of different types of grants of money they can apply for. But unfortunately, some businesses, have gone under and haven't been able to stay afloat. But there has been a lot of support. But of course, that leaves, difficulties in the community and for individuals. And that's a really big thing to think about, how it affects people where they lose their jobs or if they lose their business, and the support that those people need in other ways as well as financial.
Okay, how about in the area of utility for the populace at large? Have you been receiving some freebies like electricity, water, and these other basic utilities that are necessary for survival or daily lives? Have there been a case where you've been allowed to not pay for these utilities as water and electricity?
Yes, there are all different ways that government departments support people who are in need. So they get regular financial support, which then would cover the bills of their utilities, as you say, the electricity and food and so on. Some people, it isn't enough. For some, it's really difficult to make that money stretch for all the things they've got to pay for. And so there are a lot of organisations, charities that also support, and something called a food bank. And there are lots of them all around the country where people donate food, and then that food gets distributed to help people to make sure there's enough food on the table for the children and the families.
Well, how do these foods get distributed? Do you go to the communities and have the citizens lining up to come receive them, or how do you get them distributed to the citizens?
Well, for the food banks particularly, that the people in need are normally already supported by government workers, and so if the government workers see that they need some extra support, I think they get given a voucher, and then they can go along to a food bank, which does more than providing food. It sits down and it's an opportunity to support emotionally and to listen as the person tells their story, and also to give them pointers for other places they can go for help as well. So it's sort of a centre for lots more than giving food, but in that way then they get a 3-day package of food, to an emergency package to keep them going in the immediate, but then it's can be long-term support as well as necessary.
Okay, so it has become imperative for governments across the world to prevent imported cases of COVID-19 to the best of their strength and all that. So if you visit the various airports and seaports and other ports, land ports and all that, strict protocols have been set or put in place. And then also testing of COVID-19 from where you're coming from and before you enter the country that you're about to enter. They need to make sure that you are free from COVID-19. So various tests will be conducted and you have to pay. In Ghana, it was 150. Negotiations have been going on. It has been reduced to 50 for ECOWAS states and all that. But in the UK, how much is the cost for testing, not only at the airports, but even in the UK, if you decide to walk into any laboratory, get yourself tested and all that for COVID-19, how much do you pay?
Okay, well, if I start where you started with people coming into the country, the latest initiative by the government is a very strict initiative where people who are coming in have to isolate in specific hotels for 2 weeks, and those people have to pay for that, and they have to pay for all the testing that goes with it while they're there, the COVID testing. So that has just come in the last couple of weeks. For people who live in the UK, we have the National Health Service, which I'm sure you're aware of, and that's something that we all pay our taxes into, but it's there for all people. If they aren't able to pay tax, they're still allowed to have free medical care. If they turn up at the hospital or at the doctor's, it's free at source. So from the virus vaccinations, that's free for everyone in the country who is a resident, a citizen of the country.
So since you mentioned the vaccination or that, have some vaccines already been procured in the UK? Have you started administering these doses of vaccination of COVID-19 in UK?
Yes. The government actually has had they've really been on it for vaccination, and they've made a really excellent program of rollout for all the vaccines, different categories of people. So they started with the elderly, and most of the elderly population and the very, very vulnerable population who have very severe health conditions. have been vaccinated already, and we are working through the different categories. So the slightly less elderly people are being vaccinated, and the slightly less vulnerable people are being vaccinated now if they've got long-term health conditions. And so that's what's happening at the moment. And the centres are great. There are a lot of volunteers who work at the centres for free, no money, and they really help out and welcome people. And it's made it all possible to have so many people vaccinated because of all the kindness of the volunteers, as well as what the government's organising.
But with the program for the vaccination, are there any groups or category of persons that are exempted from being vaccinated in the UK?
Well, it's we're not forced to have the vaccine. It is a free choice whether we have it or not, but everyone is very highly encouraged to have it. There are some people who, for very severe health reasons, might not be able to have it. And at the moment, it's not something that a lot of testing's been done on for children, for instance. So that testing is about to start to see whether it's safe for children to have it. But from the adult point of view, everyone is really encouraged to have it, unless for very severe health reasons that they can't. Some people are choosing not to have it because they're very worried and frightened by it, or they want to make their own choice. But the majority, it's very high uptake. Majority of people are having it.
Well, there have been instances where, especially in South Africa, where the vaccines don't seem to be having that great impact on the virus and all that. In the UK, since you've started with the vaccination program and all that, what has been the response so far?
Well, as you know, we've got different variants of the virus here now, and but we're still encouraged to have the vaccinations that have already been developed, because they still help to fight the different viruses. It doesn't mean you might not get one, but you wouldn't be as sick with it. It's still worth having. And they're obviously, the scientists are really working hard to develop the vaccines as well to cope with the new variants that are happening. Yeah.
Okay, all right then. Thank you very much for your time with us, madam. But since you mentioned that you are an Anglican, I believe this is the Lenten period, so I wish to say God's strength to you as you go through this period of Lenten.
Thank you very much, and to you and all the people of your beautiful country.
Yeah, we are grateful. We are grateful. Thank you very much for your time.
It's a pleasure. Have a good day now. Bye-bye.
Have a good day. Bye. So, Elizabeth Quinn from the UK. Okay, so I said the US. She is from the UK and Portsmouth, to be precise. Portsmouth. I don't know if Reginald Robertson has been there, because she is more like a traveling ambassador. She has been to many places, met many people. I've never been to Portsmouth. Not been Portsmouth, UK. I've never been to the UK. But Reginald Robertson, the Morning Star, is here. Hello.
Yeah, morning. Good morning. Wonderful interview you had with Elizabeth Quinn there. If you don't take in, then you change the name. It will sound Queen Elizabeth.
Yes, Elizabeth Quinn.
Yeah.
Okay,
yeah.
so if there should be surname first,
Surname first,
then it should be
Elizabeth.
Queen Elizabeth.
Yes.